We readily acknowledge heart disease and cancer as leading causes of death. But what about the third leading cause of death in the United States? This silent killer is medical error. Medical errors have always been an unfortunate part of healthcare. Their sheer scale and impact have only recently come into sharp focus. This essay will delve into the sobering reality of medical errors in the United States. We will explore the alarming statistics, examine high-profile cases, and discuss the common types of errors that occur. By understanding the problem and advocating for solutions, we can create a healthcare system that prioritizes patient safety above all else. The statistics surrounding medical errors are staggering. According to a groundbreaking study published in the BMJ, medical errors are responsible for an estimated 250,000 deaths in the US each year. This number is equivalent to a jumbo jet crashing every day. Medical errors claim more lives than accidents, respiratory diseases, and stroke combined. These errors impact people of all ages, backgrounds, and health statuses. From misdiagnoses to medication errors and surgical mistakes, the potential for harm is present at every stage of the healthcare journey. Patients suffer preventable injuries, endure prolonged hospital stays, and experience psychological trauma. Families grapple with the loss of loved ones and the overwhelming financial burden of medical bills. The cost of treating preventable medical errors is estimated to be billions of dollars annually. Beyond the financial burden, the erosion of trust in the healthcare system is perhaps the most damaging consequence. The numbers tell a chilling story. Each year, more than 250,000 lives are cut short due to preventable medical errors. That's like losing the entire population of a city like Orlando or Buffalo every single year. These errors permeate every corner of the healthcare system, affecting patients of all ages, backgrounds, and conditions. Whether it's a newborn in the NICU, a middle-aged individual undergoing a routine procedure, or an elderly patient battling a chronic illness, the risk is ever present. This discrepancy highlights the urgent need to shine a light on this silent killer and mobilize resources to combat it effectively. While statistics paint a bleak picture, they fail to capture the profound human toll of medical errors. Behind every statistic is a personal tragedy, a life cut short, a family devastated, a future forever altered. Patients may endure prolonged hospital stays, require additional surgeries, or suffer permanent disabilities. Families are left to grapple with the overwhelming grief of losing a loved one due to preventable mistakes. The emotional burden can be crippling, leading to anxiety, depression, and post-traumatic stress disorder. Beyond the immediate victims, medical errors erode trust in the healthcare system as a whole. What makes this issue even more disheartening is the silence surrounding it. Unlike other leading causes of death that spark widespread awareness campaigns and public outcry, medical errors are often shrouded in secrecy. Hospitals and healthcare providers may be hesitant to disclose errors due to fear of litigation, damage to reputation, or a culture of blame. This lack of transparency prevents patients and families from receiving closure, understanding what went wrong, and advocating for systemic changes. It also hinders efforts to learn from mistakes and implement preventative measures. Without open and honest dialogue about medical errors, the cycle of preventable harm will continue. The human cost of medical errors is perhaps most poignantly illustrated through real-life cases that have made headlines and sparked national conversations. One such case involved the tragic death of Libby Zion, an 18-year-old college student who died at a prestigious New York City hospital in 1984. Libby's death, attributed to a fatal interaction between medications prescribed by overworked and unsupervised resident physicians, became a rallying cry for patient safety reform. Another high-profile case involved the surgical misadventure of Dana Carvey, a renowned comedian who underwent heart bypass surgery in 1998. Carvey later sued the hospital and surgeon, alleging that a healthy artery was bypassed instead of the blocked one, leading to years of pain and suffering. The case, settled out of court for an undisclosed amount, highlighted the devastating consequences of surgical errors and the importance of accountability. These cases underscore the devastating consequences of medical errors, not just for patients and their families, but also for healthcare providers and institutions. The impact of medical errors extends far beyond the immediate victims and their families. Each preventable error, each lawsuit, each news story chips away at the foundation of trust that is essential for a healthy doctor-patient relationship and a robust healthcare system. When patients lose faith in the system's ability to keep them safe, they become hesitant to seek necessary care, leading to delayed diagnoses, untreated conditions, and potentially worse outcomes. This erosion of trust also has a chilling effect on open communication between patients and providers. Patients may be reluctant to ask questions, voice concerns, or challenge a diagnosis or treatment plan for fear of being perceived as difficult or disrespectful. Rebuilding trust requires a fundamental shift in the culture of healthcare, a shift towards transparency, accountability, and a shared commitment to patient safety as the paramount priority. Addressing the pervasive issue of medical errors requires a multi-pronged approach that emphasizes transparency, accountability, and a culture of continuous improvement. Transparency begins with open and honest communication about errors, both within healthcare institutions and with patients and their families. When mistakes occur, patients deserve to know what happened, why it happened, and what steps are being taken to prevent similar errors in the future. Accountability requires a system that holds healthcare providers and institutions responsible for preventable errors, not through a punitive lens but through a framework of learning and improvement. This includes fair and transparent processes for investigating errors, identifying root causes, and implementing systemic changes to prevent recurrence. A culture of continuous improvement requires a commitment to ongoing education, training, and the implementation of evidence-based practices that have been shown to reduce errors. Medical errors encompass a wide range of mistakes that can occur at any stage of the healthcare process. One of the most prevalent types of errors is misdiagnosis, which occurs when a patient's condition is incorrectly identified, leading to inappropriate or delayed treatment. Another common type of error involves medication, from prescribing the wrong dosage to administering medication incorrectly. These errors can result in adverse drug reactions, medication interactions, and even fatal overdoses. Surgical errors, though less frequent than other types of medical errors, carry significant risks. The consequences of surgical errors can be life-altering, leading to permanent disability, extended hospital stays, and increased risk of infection. Misdiagnosis is often called a silent threat because it can lurk undetected, masking the true nature of a patient's illness and delaying life-saving treatment. The causes of misdiagnosis are multifaceted, stemming from a complex interplay of human factors, system flaws, and the inherent challenges of medical diagnosis. Human error plays a significant role, as doctors, like all humans, are susceptible to cognitive biases, fatigue, and the pressures of a demanding work environment. Systemic factors also contribute to misdiagnosis, such as inadequate communication between healthcare providers, incomplete medical records, and time constraints that limit the depth of patient evaluations. The inherent complexity of the human body and the vast array of medical conditions further complicate the diagnostic process. Many illnesses share similar symptoms, making it challenging to pinpoint the underlying cause based solely on initial presentations. Medications are powerful tools that can alleviate suffering, manage chronic conditions, and even save lives. However, their potency also makes them potential sources of harm when errors occur in their prescription, dispensation, or administration. Medication errors, one of the most common and preventable types of medical errors, can have devastating consequences for patients, ranging from mild discomfort to life-threatening complications. Factors such as illegible handwriting on prescriptions, look-alike and sound-alike drug names, and inaccurate dosage calculations can all contribute to medication errors. One of the most common types of medication errors is prescribing the wrong medication, dosage, or route of administration. Another common error is administering medication incorrectly, such as giving a medication intravenously instead of intramuscularly. The impact of medication errors extends beyond the immediate harm to patients. leading to prolonged hospital stays, increased healthcare costs, and a loss of trust in the healthcare system. The healthcare industry is enhancing patient safety through technology, systemic reforms, and a culture of learning. Standardized protocols and checklists prevent errors by ensuring critical steps aren't missed. Improving communication and coordination among providers is also key. Electronic health records ensure everyone has up-to-date information. Fostering a non-punitive culture encourages open dialogue and continuous improvement. In an era of rapid technological advancements, healthcare is leveraging technology to enhance patient safety and reduce medical errors. From electronic health records to robotic surgical systems, technology minimizes human error and bolsters medical reliability. EHRs replace error-prone paper charts, reducing risks associated with illegible handwriting and lost records. EHRs incorporate safeguards like drug interaction alerts and allergy warnings, preventing medication errors. Intelligent infusion pumps ensure correct medication delivery, minimizing overdoses and adverse reactions. Robotic surgical systems enhance precision, reduce invasiveness, and minimize human error in surgeries. Section 3. A culture of safety, shifting from blame to learning. Technology aids error prevention, but a cultural shift is crucial. Moving from blame to safety culture transforms errors into learning opportunities. A blame culture punishes mistakes, discouraging transparency. A safety culture fosters trust, encouraging error reporting and systemic improvements. Leadership commitment, open communication, and non-punitive reporting are key to creating a culture of safety. Empowering patients and families to participate in their care enhances safety. Section 1. A call to arms, protecting patients, preserving trust. The silent epidemic of medical errors demands our urgent attention. We can no longer afford to treat this issue as an unfortunate but inevitable byproduct of a complex healthcare system. The human cost is simply too high: lives lost, families shattered, trust eroded. It's time to shift our perspective and view medical errors not as individual failures but as systemic challenges that require comprehensive solutions. We must move beyond the blame game and foster a culture of transparency, accountability, and continuous improvement. Healthcare providers, institutions, policymakers, and patients must work together to create a system that prioritizes patient safety above all else. This requires open communication about errors, a commitment to learning from mistakes, and the implementation of evidence-based practices that have been proven to reduce harm. The statistics are sobering, but they should not paralyze us. Every single one of those numbers represents a life lost, a family devastated, a future forever altered. We owe it to those who have suffered from medical errors and to those who are at risk to demand better, safer healthcare. This is not just a matter of improving statistics, it's about upholding the fundamental human right to safe and effective medical care. Section 2. Empowering patients, engaging communities. Patients play a crucial role in their own care. Empowered patients can reduce errors and advocate for their well-being. Ask questions about diagnoses, treatments, and medications. Seek clarification and second opinions if needed. Keep an updated list of medications and share it with all healthcare providers. Engage with communities to advocate for patient safety and support policy changes. Section 3. Towards a future of safer healthcare. The journey towards a future of safer healthcare is a continuous one, requiring ongoing vigilance, innovation, and collaboration. We must remain steadfast in our commitment to learning from our mistakes, embracing new technologies, and fostering a culture of safety that permeates every level of the healthcare system. The widespread adoption of electronic health records, coupled with robust data analysis and sharing, has the potential to revolutionize patient safety. By leveraging the power of big data, we can identify patterns of errors, detect potential risks, and develop targeted interventions to prevent harm before it occurs. Furthermore, we must continue to invest in research and development of new technologies and approaches to enhance patient safety. This includes exploring the potential of artificial intelligence, machine learning, and other cutting-edge technologies to augment human capabilities, reduce cognitive overload, and provide real-time support for clinicians in making critical decisions. The path forward is clear, but the journey will require unwavering commitment, collaboration, and a shared vision of a healthcare system that prioritizes patient safety above all else. By working together, we can transform the landscape of healthcare and create a future where medical errors are no longer a silent epidemic but a distant memory. Thank you for watching. If you like this content, please don't forget to like, share, and subscribe.